The White House says President Trump is being treated for a medical condition that causes swelling in the legs. The president, who is 79, was diagnosed with the chronic venous insufficiency, or CVI.
And to tell us more about the condition, what it means for the president's health, is Dr. Prakash Krishnan, the Director of Endovascular Services at Mount Sinai Fuster Heart Hospital. Doctor, thank you for being with us this morning. Can you walk us through what CVI is and how it's treated?
Well, thank you so much for having me, Cindy, and it's really a pleasure to be on to help explain this condition. So CVI is a very common condition. It affects about 25 million Americans basically have varicose veins or some form of CVI. And it's very common as we get older. You know, about 6 to 7 million Americans actually have similar conditions with what President Trump has with the swelling of the legs. So the condition itself, it's important for our audience to know that it's a very benign condition in that it's not going to cause any leg loss or anything serious unless it's left uncontrolled. So it's important when the patient sees this type of swelling in the legs to go get immediate care to be able to make a diagnosis of CVI.
We're just looking at some other images, and the White House press secretary attributing bruising seen on the president's hand to excessive handshaking and aspirin therapy. Is it consistent with what you'd expect in someone with CVI to also have bruising, or what other things might we see with someone with CVI?
Absolutely. CVI usually affects the lower extremities. Bruising of the hands with President Trump is likely because of his aspirin use for cardiovascular risk factor modification and excessive use. But CVI usually is a spectrum. It starts with just the heaviness of the legs that we all may feel as we get older. But again, you've seen many patients with spider veins and maybe isolated varicose veins. These are the earliest signs. Then that progresses to a little bit of swelling that may be persistent and more prominent at the end of the day. And then eventually the worst part of it was the discoloration of the skin and the ulcerations, which is what we all as clinicians hope to avoid in our patients.
And doctor, in your opinion, does this diagnosis impact his overall health or ability to perform his duties?
Well, if the diagnosis is CVI, absolutely not. The president will be likely treated conservatively. He'll have a great prognosis. He'll have to likely wear compression stockings when he knows he's on his feet for a long period of time. And potentially, if that does not respond, he could be a candidate for a minimally invasive therapy to actually get rid of the vein that's offending and causing the CVI.
Dr. Prakash Krishnan, Director of Endovascular Services at Mount Sinai Fuster Heart Hospital. Thanks so much for taking some time to talk to us. We appreciate it.
Thank you again. I hope I was helpful. Thank you.
Certainly.